So what are the benefits of the liquid facelift over the surgical facelift? Basically, obviously cost. Even a liquid facelift is one of the more expensive things we do, and that's typically just because of it requires several different products, and the products are not inexpensive. However, they work great, they're safe, they're hypoallergenic, they gradually go away over time. So all the things that make them great, also make them expensive. But it's better than surgery on the cost end. It can even be a little higher than this depending on the patient, but typically my first go around with patients is going to be somewhere between $1,000 and $2,500, and that's mixing all three different products, meaning the Botoxes, the gels, and then that Sculptra. Surgical facelifts, if you get the whole kit and caboodle, it's going to be somewhere between $10,000 and $20,000. They got us beat on longevity. A surgical facelift is going to last 5 to 8 years, typically, maybe 10. If you have a facelift when you're 45, most women have to have it redone when they're 55 to 60. So nothing lasts forever, not even surgery. A liquid facelift, that bottom, that Sculptra, I've seen it last 3 years or longer. So usually once you get this in, you don't have to really do it frequently. The gels, you have to come back at once 6 months at the beginning, but the more you do it, it can start to last longer. But the gel fillers usually have to be touched up about once a year. Botox, no matter how long you do it, you don't build up more of it. It's really gone in about 3 to 4 months. And other pros on our side are obviously there's no downtime. You can go back to work. You don't have to miss a lot of activities. And where surgery, it's 6 weeks. This is a patient that actually had these really sunken in troughs right in here, you can see. And she also had some pretty deep marionette lines. Her nasolabial folds were really not that bad. And we put 2 syringes, first we put in her Sculptra. And I don't have an after. She hasn't come back to see me yet, but I'll hope to get those in the near future. But you can see this trough and this groove and this depression that she had because she lost her cheek volume. We filled all that back in. And she had a vial of Sculptra and 2 syringes of Juvederm in the cheeks and probably 1 syringe. She wasn't ready to do her lips. She has since come back and had a little bit of lips, but she was a little overwhelmed by everything we did that day. So this is actually a patient I did in my clinic. It's not going to show her Botox, but she's actually had Botox that day as well. And she got a 1 to 2, about a millimeter lift in her brow. This is not my patient, but this is a good example. This is a younger patient, but you can see basically the nasolabial folds are starting to get that indention in the lower. This patient still has good lip volume, so it's not a lip enhancement, but it's more this area in the cheeks and around the mouth. We could show a lot more before and after, but I'm trying to keep this to 30 minutes, so we're going to